Good morning, Meridian, and welcome to Business Buzz. We're here today at the Cottonwood Creek Behavioral Hospital here in Meridian with the CEO, Kevin Finley. Thanks, Kevin, for joining us today.
Thanks for coming, John.
Yeah, thanks for having us out. So Cottonwood Creek Behavioral Hospital opened in 2019.
That's correct.
And including the expansion of bed capacity and additional new services such as the intensive outpatient service clinics and the electroconvulsive therapy. I got that right.
That's right.
All right.
ECT as well.
Yeah, ECT. Can you share some insights on some of the key factors that have driven the growth and the expansion or services that are common here at the hospital?
Yeah, so we opened again in 2019 with 72 beds. Currently, we operate 92 beds. We operate at full capacity as well. Our growth in the market has just been due to a lack of services and lack of beds available for the mental health services in Idaho. There's a tremendous demand. I think through COVID, we saw that demand increase, and keeping up with the volume and the need has been a challenge. The state needs more beds, actually. So we opened additional 20 beds. And then we started intensive outpatient programming, which is where individuals can come and get treatment 3 to 4 days a week for about 10 to 12 hours per week, but they still go home rather than inpatient, where patients are admitted and they stay with us for an average of about 8 days in the hospital. Mm-hmm. And then a couple of years ago, we opened the electroconvulsive therapy, the ECT clinic, which is a wonderful procedure in psychiatry. It's an interventional procedure that focuses on treating depression that's resistant to other forms of treatment. So depression that people aren't responsive to medications. It's actually become a frontline treatment for many individuals. And in July of this year, we'll start providing services for adolescents, ECT services.
Yeah. So you mentioned COVID and seeing an increase since then. A lot of things have changed since COVID. We've seen a huge number of people moving to the area and growth in population, but COVID also and societal challenges and stuff. Which do you feel like is maybe the bigger factor driving that demand right now?
I would say the increase in population and just not having enough services in the state. But COVID did create for all states an increase in utilization of inpatient treatment. So to be admitted to the hospital, you have to be considered a danger to self or others. So majority of our patients come in suicidal, and it takes us about 8 days to get them to a point where we feel safe for them returning home and returning into outpatient treatment.
Okay. With a mission to improve the communities, families, and the lives of those you serve, how does Cottonwood Creek Behavioral Hospital engage with the local community here in Meridian and across the Greater Treasure Valley?
So we're really active with Chambers of Commerce. We're active with several different organizations, with police departments, with NAMI, which is the National Alliance for Mental Illness, with Idaho Department of Health and Welfare and all of their services, with the Hospital Association here in the state. We do quite a bit of work with legislative bodies and groups. It does take an entire village to treat the patients that we treat, and so we all come together.
What are maybe some of the initiatives that you work with these organizations on that suicide prevention, I'm sure,
Absolutely.
is high on the list. Mental health,
crisis intervention, crisis management, working with the police departments, their crisis, their CIT teams that go out and respond to people that are in crisis. We work with them on providing services, getting them into the hospital, having a smooth transition. Reducing the need to go to the emergency room is a big deal. For years and years here in Idaho, because there was a lack of beds like ours, people would stay in an emergency room for 2 or 3 days, up to 2 or 3 weeks waiting for a bed. And we've been able to reduce that significantly.
Yeah. You mentioned earlier that it has a dedicated program for adolescents 12 to 17. What innovative approaches, treatment approaches, or therapies does Cottonwood Creek offer adolescents that really sets your program apart from others and that may be available?
Really, we kind of distinguish ourselves as our medical staff. We have 16 different board certified physicians, 8 of which are fellowship trained in child and adolescent treatment. So we have doctors that are specialists that are treating the patients at our hospital. We try to avoid using kind of a mid-level approach to care. We feel like psychiatry is a specialty just like cardiology or oncology, and you want a physician that's seeing that patient every single day, that's attending to their care and to their needs. And so we're different in that, where we have so many. In fact, I moved here from Oklahoma in 2019. I told you that earlier, and I don't know that we had 8 fellowship trained child and adolescent psychiatrists in the whole state of Oklahoma, and I've got 8 of them on staff here at the hospital, which is pretty cool.
Yeah, excellent. So are there any new programs specifically aimed at improving adolescent mental health here at Cottonwood?
So we're expanding in our intensive outpatient program with adolescent services, and we offer a model that is a hybrid model, meaning that you can either come to the facility and receive care, or you can receive care through telehealth. So we can meet people in rural Idaho and meet their needs. We have a family program that's a couple nights a week for patients who are in the hospital. Their families can come and learn about the services that we provide. So it's a family group or a family education series, which is unique. We just rolled out a new handbook for families. It's on our website, but it really explains a lot about the care and the treatment that we provide, what to expect when you're in the hospital. Psychiatry is still scary for a lot of people, and they think of things like One Flew Over the Cuckoo's Nest, and that's not what we do here. It's a wonderful program, and we see quite a few people get the help that they need, and we've treated a lot of people from Meridian and all around the state in the last 5 years.
Well, it's definitely needed in our communities. Mental health is something everyone should be very aware of and take advantage of the resources that are there. Yeah. So, Kevin, what are some of the best ways our viewers can find out more about Cottonwood Creek Behavioral Hospital if they want to learn more about the services in the facility here?
Oftentimes, when you need the services, you're in crisis. So we want to make sure that people have access to that services. So we're open 24 hours a day, 7 days a week. Our admissions department is there to answer the phone if you're in crisis and you need help. You can reach us online through our website, but we're here to help any way we can.
Well, Kevin, it's great to have your facility and your team as part of our community here in Meridian. And thank you so much for joining us today.
Wonderful.
And inviting us in. Meridian, we've got a few chamber events coming up that you can participate in. June 26th, we have our Women in Leadership event. It's going to be a nice networking panel discussion event. Come out and join them for that event. And then also we're opening up registration for Queens of the Green. It's our ladies only golf tournament coming up August 9th. Registration is open on our website. Also open is nominations for our Business Excellence Awards. That luncheon and award ceremony will be August 29th. So be sure and get your nominations in for the companies that you'd like to see recognized at this year's event. Until then, have a great weekend, Meridian.